Welcome to my presentation on epilepsy, seizures, and your emergency response. By the end of this informative presentation, I hope you have a basic understanding of what seizures look like and how to respond to one safely and effectively. Seizures can be scary for someone who has not dealt with one before, but you can be an effective helper. Seizure first aid is a great skill to have, and it isn't very hard to learn. About 11 years ago, I was introduced to the Epilepsy Foundation of Michigan because my then infant son was seizing fairly regularly. Over the years since, I have learned a lot about epilepsy, seizures, and caregiving for someone who has a chronic medical condition. 1 in every 26 Americans will develop epilepsy, so you have a pretty good chance of witnessing a seizure at some point in your life. While you can't really do much to stop a seizure once it starts, you can act in a way to minimize situational harm. The Epilepsy Foundation of Michigan says that you have to see a person stare off into the distance. You may see a person stare off into the distance with twitches, tremors. Their head may tilt. They may make chewing motions with their mouth. They make repetitive motions such as pulling on their collar. Verbal noises are common. I stutter when I go in and out of a seizure. There may be a combination of these symptoms. All things can happen in seconds or in minutes. The person that had the seizure may not even know it happened. They could go unresponsive to questions and touch both during and after. The Epilepsy Foundation will also warn you that grand mal or tonic-clonic seizure is the greatest chance of harm from falls, objects around the person, or people who misunderstand the situation. In this type of seizure, a person may suddenly stop and fall to the ground. Their eyes may roll back. Both or one side of their body will jerk or spasm or go very stiff. They may have mucus in their mouth, vomit, or lose control of their bodily functions. Their skin can turn a bit blue in color, and they make strange noises. All seizure types may leave the person fatigued. Their muscles may feel some discomfort, but their breathing and skin tone should come back to normal fairly quickly. There may be a sense of disorientation or confusion, and their speech may be slurred or stuttered. The authors of Epilepsy and Behavior 2005 say there's a chance that a person with agitation, aggression, or fear may present in a manner that will scare some people. In the past, people have been arrested for being drunk or high following a seizure based on the behavior and the lack of understanding from bystanders. A 2006 article from ABC News talks about a Michigan man who was arrested because someone looking out their window misinterpreted his seizure movements as a lewd act and called police. There are old first aid habits that cause more harm than good. Put away the leeches, don't try to cast away the demons, and don't put anything in the mouth of someone that's seizing. They can't swallow their tongue, though they may bite it or their cheek. Keep calm and remember to breathe. Make sure there isn't anything around the person that can harm them. Don't let anyone hold them down because that can also cause injury. Someone should time the seizure. Someone else can gently roll the patient onto their side in case there is vomit, and someone can place something supportive under their head. Check for injuries when it's safe to do so, but don't be invasive and always be respectful. Most seizures are short and the person can return to their normal selves and routine very soon. So you'll just stay with them until they're ready. You may ask them if you should call a family or a friend. You can remain with them and be reassuring. Let them know what happened, that they are safe now, and that you will stay with them. You may call a professional in if the seizure lasts more than 3 minutes, if it's the person's first seizure, if the person has injured them in some significant way, such as in the fall, or if someone has criminally taken advantage of the seizure, such as stolen someone's wallet. You do not need to call just because there was a seizure. Not every seizure needs a hospital. In fact, most don't. Just keeping the person safe or finding someone they know to keep them safe during the recovery moments is often all that's needed after the seizure passes. Seizures can be dangerous and even deadly. There are times when a person causes an accident from being into the seizure, so it is important that you act as a bystander. You can make a difference. Twice this year I had public seizures. Both times, the people around me helped get me through it. You can make a difference just by knowing and acting on some of what you learned today. Thank you.